This segment of Delmarva Life is brought to you by Community Behavioral Health.
If you are one of the hundreds of millions of people who suffer from depression, or maybe you've got a loved one battling the mental disorder, you already have a good idea of the devastating effect it can have on somebody's life. The words hopelessness, lonely, isolated, often used to explain depression. Point blank, it's a place that nobody really wants to be. There are medications that'll treat depression, but in some cases they are not the solution, and that is where the professionals at Community Behavioral Health can help. Lisa stopped by to learn more about a fascinating treatment that's finally giving many patients hope.
On the surface, it seems okay, and then, when I'm alone or to my own thoughts, that's when I suffer.
And Bob has suffered from depression for most of his life.
And it's exhausting just to try to keep up a front.
He couldn't take antidepressants.
I tried treatment for, periods of time and multiple medications, and I'm very sensitive to medication, hypersensitive. The side effects are, so bad that, I have to stop the medication.
It's important to note that depression worldwide is over 350 million people suffer from it.
Dr. Neeru Jani of Community Behavior Health says Bob is a perfect candidate for a procedure called Trans-cranial magnetic stimulation, or TMS.
A patient who would benefit from TMS therapy is an individual who has a history of major depressive disorder that has failed to respond to one or more antidepressant treatments.
To explain how TMS works, it's important to know that antidepressants affect certain brain circuits and the chemicals that pass along signals from one nerve cell to another in the brain. These chemicals include serotonin, dopamine, and norepinephrine. People suffering from depression lack that chemical passage.
Instead of using medications to increase your serotonin levels, we use localized, very directed electromagnetic pulse stimulation to allow a discharge of releasing these chemicals so that we can have a robust response and treat depression.
TMS targets a part of the brain called the dorsolateral prefrontal cortex.
This stimulation generates an electro pulse which develops an action potential or enough energy to release chemicals that we're familiar with are responsible in depression.
Getting that magnetic stimulation to the exact spot in the brain requires precise measurements of the patient's head. A cushioned helmet is then placed on the patient so that brief magnetic fields can be used to target the areas responsible for firing the neurotransmitters or chemicals that pass along from one nerve cell to another in the brain. For Bob, it was definitely worth a try.
What intrigued me is that, it can physically change your brain. It can, alter the part of your brain that affects your moods and so on to help you so you don't need medication, or that maybe you can, lead a kind of a normal life.
Dr. Johnny says TMS should not be confused with electroconvulsion therapy, where electrical currents are passed through the brain to trigger a seizure.
After the treatment, you are completely awake, alert, and oriented. You can go drive your own transportation back home or to work, so there is no time lost.
The TMS procedure requires daily sessions done Monday through Friday over 3 weeks. Each session takes about 20 minutes. At the time of this interview, Bob was about halfway through treatment.
It has helped, I know, because I am going through a lot of stressors in my life right now, and things are very rough. And prior to getting the treatments, I know that would have brought my mood down to the point where I wouldn't be able, being functioning at all. I'd be probably, sleeping all the time or home in bed. But now I feel like I'm coping with what's going on. I'm not happy, but I'm at least, I'm coping.
And that ability to cope is giving Bob something he hasn't experienced in a while: hope.
Yeah, it has given me hope to, even though I'm not feeling, skipping down the street, I think that I can hang on here and look forward to something going on in the future.
So what's it feel like to wear that cushioned helmet during treatment? Patients hear a little tapping sound. They feel a tapping sensation, but that can be diminished with the use of earplugs. Would you like to read more from Community Behavioral Health about transcranial magnetic stimulation? All you have to do is go to delmarvalife.com.